when you open the collection, that's the first page that you see. That is the address. And then the other part, this is also part of the home screen. You can see there are several communities in this collection, although there isn't much in some of them. We have some other universities, public universities and private universities, and one College of Nursing. That's the project team. We have the project coordinator who's here, and then one person from the IT department in the library. Then we have our outside IT consultant based in the UK, and several other people working on the project. I will not go through the goals and objectives. That's what we had put when we were writing the grant, that this is what we want to do. And these are the anticipated project benefits. So if people are interested in the project goals and the anticipated benefits, we will be gladly to share the proposal that we had written. The project, we did launch the whole project. We invited people from several institutions in Zambia, and we had a meeting in the School of Medicine, where we did explain what it is exactly we wanted to do and what we wanted to achieve, and invited everyone to be part of the project. After that, we held another workshop where we invited another team of people from different nursing colleges and institutions, and specifically for those institutions that are a bit far from, not a bit far, quite far from Lusaka, were also invited. This was held in February 2018 this year, and we had 22 participants from 13 institutions. So in terms of management of documents in our repository, it's a multi-task team. There are several people playing different roles. There are people who are doing the scanning, who are the students. Also, there are people who are specifically scanning the internet to get relevant content. Then we have one person who does the metadata, and then two people who do the approval, me and Mrs. Mafulio, although it is mostly Mrs. Mafulio, I think, who's doing all the work. I think what we have realized is that one person doing the metadata is not enough. So we have a lot of things that have been uploaded, both from the scanning team and the people who are searching for documents online. But there's a gap. So we have decided that we will need to assign 2 more people to do the metadata. Oh, I should talk about quality assurance. The quality assurance is between me and Mrs. Mafulirwa, but as I was saying, the work is mostly hers. Maybe we'll need to assign another person to add to our team so that we are 3 members of staff doing that work. So in terms of usage statistics, this is as data collected from the 9th of October. We have 206 documents that have been archived and are already being viewed or downloaded in a number of countries. But as I said, we still have some documents that are, I think we have 306 that are not yet uploaded because of that metadata problem. So total number of downloads is at the moment is 1,448, and an average download of 7 per item. Remember, we started doing this work in April this year. So of course, that is another slide which shows our usage statistics, showing publication range. And what we can see from this picture is that in terms of interest, I think all the publication dates are quite useful to the people that are visiting our repository. And the countries, I I think the one with 32%, I'm sorry, the slides is a bit small, you can't see. Zambia is number 2. So.
Okay, so the first one with 32% is the United Kingdom. So that's the traffic that is going into that particular part of the repository, which is the ADHL. So traffic normally isn't coming through from 32% United Kingdom, Zambia 21%, then you've got United States at 17%, South Africa 11%, then we have Kuwait, Japan, Mauritius, Ethiopia, and Russia. But those are the top 10 countries, basically.
Mm-hmm. Thank you, Nelson. Then this is another picture which shows a trends analysis over the time we started from April to October. And you can see that it's increasing. Even October, this was done, I think, the beginning of this month. Yeah. But already you can see this, the level of usage is quite high. Then the top search items, that shows the terms that people are putting in to search our repository. And what pages the users are visiting is also indicated. And where they are accessing our repository from, the desktop, it looks like it's leading, although it's the differences between the mobile and the desktop is a bit small. The tablet is quite low. But you can see that, especially the mobile, maybe we need to do more to create some apps to be able to make it friendly and for our users, because that is quite high, 42%. Then we did embark on promotional activities. So far we have done 10, I think 10, but we excluded some. So I've just listed about 10 that we have done. And I'll show you quickly what those are. We had a radio interview on our Zambia National Broadcasting Corporation, that is the state broadcaster. It reaches everywhere in the country. So we had one of our assistant librarians and a student assistant talking about the ADHL. And these are some of the questions and answers. So question 1, I'll just read one of them. Recently, UNZA Library, through the Satellite Medical Library, launched the African Health Digital Library. Would you explain to the listeners what the ADHL project is about? So that's an example of the questions and the answers that our members who were on radio discussed. Then the promotional activity number 2, we had our Library and Information Association General Conference in Livingstone. Livingstone is a town which is about 450 kilometers from Lusaka. One of our members again went and gave a presentation on the project. On the medical schools celebrated Golden Jubilee, so it was an opportunity for us to showcase our ADHL. That is our members with the Dean, Professor Kaile, at the activity. That is our member with our former Dean, Professor Goma. And that is our coordinator with the Director of Training in the Ministry of Health at the Jubilee celebrations. Then the next activity we did was we did exhibit at the Agriculture and Commercial Show, where our members participated actively. There they are showing the show goers what the ADHL is. Another show goer asking for, we had created some brochures and information leaflets on the ADHL. The University of Zambia won the first, isn't it? The first in the educational category. So we think that our activity promoted to that win. Then number 5, one of our team members went to India for a training, and they took that opportunity to present the ADHL to the various people that were in that training activity. Then we embarked on now countrywide promotional activities. This is in Livingstone, which is about 450 kilometers. We presented to the School of Nursing and another School of Medicine. Of course, there were questions that were asked. Then this is another activity in another part of the country, which is about 700 kilometers from Lusaka at the University of Barosland. Our member there, our project coordinator, talking to the students. There they are speaking to the vice chancellor of that particular institution. Also, in that same town, we went to Lewanika School of Nursing, and our team members, the project coordinator and the metadata person, were the people who were speaking to nursing. These are nursing students in training. Then this is another school, nursing school, where they were in Senanga, which is it's about 800 kilometers from Lusaka. Again, our project coordinator was very active in that activity. So I think there were a lot of the outcomes of the promotional activities that we noted. There's just definitely a lot of interest in the project, but also interest from both accessing the resources that are available, but also in people wanting to be part of this project. So our future plans, obviously we want to map our dissertation collection, because our dissertation collection sits in the main University of Zambia repository, so we want to map that to the ADHL. We also want to have it available on mobile phones, maybe also use more of social media for promotion. And we still want to cover the whole country, to visit all the provincial nursing colleges so that they can actively participate, either as users or join the project. And then we also want to do an evaluation in 2019. Our IR policy is still in draft, but it has already passed all the relevant stages within the university. So the next stage that is remaining is for it to go to council for approval. So challenges, yes, the challenges were there, but I don't think there are challenges that we cannot work on. So I will not go through all the challenges, and maybe they can come up in the question and answer session.